Hello, Dr. Tony Hinton. Thank you for being my guest today. You are a retired consultant surgeon for the NHS. You have over 30 years experience. Could you tell me what made you start to question the government's COVID policies?
Certainly. Thank you very much for inviting me on. At the beginning of the pandemic, and it's odd that we now refer to the first year of the pandemic and the second year of the pandemic. So way back in March and April of last year, the initial lockdown, I didn't actually criticise because literally no one knew what was going on. And everybody was very wary, very scared, very frightened, the government as well as the population. And I think they had little choice. But by the middle of April, two things had happened. Do you remember the cruise line of the Diamond Princess?
Yes, I do.
Now, what the Diamond Princess showed is you had a captive population, and it was like a little experiment to see how severe COVID was and how much it would spread. And actually, what we thought was maybe going to be, could have been 5% mortality rate, turned out to be less than 1%. And in fact, now is far less than that.
Yes.
So it was nowhere near as bad as was first feared. The second thing is that in the UK, by about the second week in April, I think it was April the 10th or something, you could see that the number of deaths in hospital was beginning to fall. Now, if you then follow back the figures for how long it takes from someone to go to ITU to die, how long it takes for someone to go to hospital to end up in ITU, from how long it takes for someone to get infected to end up in hospital, you work back to probably the second week in March. So that means infections were already starting to fall the first or second week in March, well before any lockdown measures. So the lockdowns were not needed.
Yes.
Now, of course, what we found out since is not only were the lockdowns not needed, but they have caused immense harm.
Yes.
And I would say that we will find eventually, and I think it will have to be agreed by all sides, that lockdowns will have killed far more people than COVID. And actually, a lot more young people with young families. The average age of a COVID death in the UK is still around 82, 83. But you've got people dying of cancer, a lady I know of, 39, 2 teenage children, a husband. She has stage 4 cancer. She can be helped. Her symptoms can be alleviated. She cannot be cured. She'll be dead within the next 18 months. Absolutely terrible waste of life.
Yeah, it's horrendous. It really is. And I'm just going to point to a recent Telegraph article saying it's the biggest cancer catastrophe ever. Apparently up to 740,000 potential cases have been missed. What are your views on that?
Well, of course, we shouldn't frighten people because that's 750 cases that should have been referred by now. All of those cases would not have been diagnosed with cancer.
Right.
But let's say it's just 20% that would have been found to have cancer. That's 150,000 people out there with a cancer that, if it is found, is going to be found 6 months, 9 months, 12 months after it should have been identified. And cancer is a disease where early diagnosis makes all the difference.
Yes.
Now, in general, the diagnosis of cancer and the classification very complicated, but if we keep it just simple and straightforward, you've got roughly 4 stages of cancer, 1 to 4. Stage 1, 90% of those patients can be cured of their cancer. 90%.
Right.
Stage 4, 10% of those patients can be cured of their cancer. The others can be helped. The others can have symptoms relieved. but they cannot be cured of their cancer. It has gone too far. And my colleagues are telling me about increasing number of patients that they see. I was talking to an oncologist yesterday,
Right.
a very eminent professor, and he said they are seeing these cases every single week. And as I said before, they're younger patients. They're not generally the sort of patients that are dying of COVID, that are often very elderly, lots of other illnesses. These are patients that are fit and well otherwise and could be cured and have maybe another 40 years of fantastic life ahead of them.
So are they seeing cases sort of in the sort of stage 4 in that group?
They're seeing far more late stage cancers. Absolutely. Patients that should have been seen 6, 9, 12 months ago. I mean, the government told everybody to stay at home, very strangely, save lives and protect the NHS. Well, it hasn't saved lives. It's causing lots of deaths. And this cancer crisis is going to go on for years. I spoke to another eminent cancer surgeon, Professor Carol Sikora,
Yes.
and we were talking about our concern as to whether this would ever really come out in the open. Because I said to him, well, these things are going to gradually trickle through. Maybe we won't really see the signal. It'll just be all anecdotal stories. And he said, no, actually we will. He said, because compared to other European countries, for instance, Germany or France, where they've got a lot more beds in their hospitals, a lot more ITU capacity, a lot more doctors, they did not tell their population to stay at home to protect their health service. They carried on being seen. They carried on being treated.
Right.
It was the UK in particular. So what we will see over the next 5 years is the cancer death rates in the UK going up and up. And in continental Europe, they will stay roughly flat as they've been. And that difference will become more and more apparent, I'm afraid.
Right. It's shocking, isn't it? It's just shocking.
Absolutely.
I just wanted to touch on, obviously everyone's talking about this new highly infectious variant, the Omicron variant.
Yes.
What is your thoughts on that, on the new variant, and how the government has responded?
Well, I've been interviewed about this on a couple of occasions in the last few days. And my take on it is that it could well be a good thing rather than a bad thing. And I don't think we need to panic.
Right.
Really, what we need to do to finish this pandemic is we need a variant that will spread quickly, which it looks as though this one does, but gives mild symptoms, which so far is what it seems to do.
Yes.
But there's a little caveat on that, because most of that information at the moment is coming from South Africa.
Yeah.
And the information is very good. It's very solid. It's very reliable. But South Africa has a very particular population. They only have 5% of their population older than 65.
Right.
Now, that's very different than a Western European country or the United States, where we have a much higher proportion of more elderly people.
Right.
So is it very mild in South Africa because they have a lower age range, or is it really a milder disease? Now, there's some stuff just came out of Israel today,
yes,
that seems to confirm that it looks to be a milder disease.
Yeah.
So if it spreads quickly, it's a milder disease. We have, if you like, a natural vaccine to this COVID pandemic. And again, we know from Israel, and data elsewhere now confirms it, is that the people that have had COVID, their immunity is about 27 times better than people that are vaccinated.
Right.
And the other thing about this new variant is it does seem to affect people that are vaccinated. The vaccine seems to give very little protection. And if you think about it, there are two things really. Of the 4 people in Botswana that had it, all 4 were double vaccinated. if we look at how this has spread from South Africa to Hong Kong, to Canada, to the UK, Germany, France, Belgium, how did it get there? It got there by people going on long distance travel. And for long distance aircraft travel, you have to be double vaccinated. You have to take a test before you go. You wouldn't get on if you had symptoms. And so it's mainly must have been spread in people that are already vaccinated. It's not this pandemic of the unvaccinated, which I think is just a terrible, terrible term.
Yes.
Some of these terms take us back to the 1930s.
Yes.
You know, people don't remember their history. And they say, you know, if you don't learn from history, then you go on and repeat the same mistakes. Let's hope that isn't the case.
Yes, no, I absolutely hear and agree with what you're saying. And it's very alarming, obviously, Austria's sort of introducing legislation starting February 1st, I believe, next year, of mandatory vaccines.
Yep.
And anyone who obviously isn't will be fined on the spot, who knows, taken off to prison or being forced to take the vaccine. It's so alarming. I wanted to ask you, Tony, what your thoughts were on, I noticed you tweeted recently your thoughts on the health secretary's strange statement that he made. Well, you described it as a strange statement. He said, when he said, it looks like the new variant can evade the vaccines, therefore get your vaccine booster shots. So you highlighted the fact that it was an illogical statement that he made. Could you expand on that, please?
Well, it's just completely contradictory, isn't it?
Yeah.
If they're suggesting that this new variant may evade the vaccines, and in fact, perhaps we'll talk about this in a second, but the existing variant evades the vaccines.
Exactly.
But let's just talk about the new one. So if it truly evades the vaccines, where is there any common sense is saying to people, therefore, get another dose of this vaccine that the variant evades? It's nonsensical. But I'm sure everyone I've spoken to about this, and every interview I've done, I've spoken to people, you say to them, I'm sure you know people that have had 2 doses of the vaccine and then they've caught COVID.
Yep.
And everyone says, yes, I do. I know so-and-so and so-and-so. And so the existing vaccine does not stop you catching COVID. And in fact, if we go right back, for instance, to the original Pfizer trial,
yes,
and there's interesting stuff coming about that, they never claimed that it stopped infection.
Yes.
They never claimed it stopped going to hospital. They never claimed it reduced deaths. The only thing they ever claimed was it reduced your symptoms slightly.
Yes.
And actually, when you look at the original Pfizer trial, although nothing was ever made of this for obvious reasons, in the placebo group, they had 15 deaths. In the vaccine group, they had 20 deaths.
Yes.
Now, that isn't enough to make any statistical statement about. That could be complete fluke. But it just is very strange it was never mentioned.
Well, it's also very strange that in your treatment group, you have more deaths, you have more mortality. And based on that data, they went ahead and the FDA licensed, authorized emergency use authorization for the Pfizer vaccine, kind of based on that terrible data. If you think about it, it makes no sense. It's illogical. I wanted, since we're talking about the vaccines, I wanted to talk on the vaccine adverse events that are happening globally, really, that nobody in the mainstream media is really talking about. Other than I think GB News has touched on that. What are you seeing? What are your colleagues seeing in the medical world? Could you share that with me, please?
Yeah, I'll talk a little bit about my own experience. Then I'll talk a little bit about the American database for adverse reactions. So my own experience I'm an ear, nose and throat doctor, so I have a narrow area of patients that I see with those particular symptoms in my specialty.
Right.
And I have 2 patients that have had problems after catching COVID. And they were both patients with a condition, particularly that I treat, called tinnitus, which is noise in the ears. And that is a thing that you can get after lots of different viral infections. So that isn't particularly a surprise. And the 2 patients I've had are both responding well to the normal treatments that I would use, and they're getting better. I've seen 8 patients with similar problems to that have started within hours of the vaccine.
Right.
So undoubtedly, they must be linked. And again, that doesn't surprise me, because the vaccine is producing this spike protein, the same thing that is part of the virus that causes the issues with the virus. The spike protein, you would expect to cause similar issues as the virus, and indeed it does. And that I've had 1 patient with loss of taste and smell, and again it does seem to be gradually returning on the usual treatment. And I've had 7 patients with this tinnitus, this noise in their ears. So we have to fully investigate each patient to make sure there's no other cause, to rule out other rare causes. And luckily with these patients there weren't, and they're slowly improving on the usual treatment. I have an ophthalmology colleague, that's an eye doctor.
Yeah.
And every month doctors have to have a meeting to discuss between themselves patients that have had complications, issues, odd things that weren't expected, to learn and improve what we do. We have what's called a morbidity and mortality meeting. And so I presented my patients with these post-vaccine problems. And then the ophthalmologist said, oh, well, he'd had 2 patients that had gone blind in one eye from retinal vein thrombosis. So I said, I hope you've done yellow cards on those, which is the reporting system that UK doctors use to report complications from new treatments. And he said, no, he hadn't, because he wasn't sure it was from the vaccine. And I said, well, that's not your job. I said, all you do is report the fact that you've seen it. And then the MRHA look at all this data coming in, and they see, can they see a pattern? Is there suddenly lots of this condition turning up that they've not seen for the previous year? I said, you don't have to decide one way or the other. You just put in the data. But if people don't even put in the data, they'll never see the pattern.
Yes, exactly.
So he did then do his yellow cards.
Good.
I would say the problem with our yellow card system is that I think it works quite well as a reporting system, but it's very, very difficult for anyone to look at the data.
Right.
So, for instance, when they talk about deaths after vaccines in the UK, I think currently it's running at about 1,500, 1,600.
Right.
But it doesn't say when the deaths occurred. It just says deaths soon after vaccination.
Right.
That's all it says. If you go to the American system, it's much, much better. It's a very open system. All the data on it is checked, as it is in the UK. But for instance, the American system, you can look at, if you've had a death after a vaccine, you can see the date of the vaccination, even the batch number of the vaccination,
right,
and the date of death. And all of that data, if we just look now at, there are lots of other complications, but if we just look at deaths after vaccination, there's a very striking graph that people have drawn from that data. Now, if none of these deaths are caused by the vaccine, what you would see is if you took deaths for the first 30 days after the vaccine, you just have a straight line. Let's say, for argument's sake, it would be 100 deaths a day.
right.
That's just the normal number of people dying each day and it doesn't change because the vaccine didn't affect it. But we don't see that. What we see is day 0, when they had the vaccine, and day 1, we see a huge spike of about 10 times the background rate. And then it slowly drops down to the background. Well, that tells you something is happening on day 0 and day 1 that is related to something that happened on day 0.
Yeah.
And the only thing with those patients that happened on day 0 was they had their vaccination. Now, I would say every treatment we do, there are benefits and there are risks. And when I do an operation, I have to discuss the benefits and risks with the patient. And a vaccine is exactly the same.
Yes.
Now, I think the problem that's happened is when we started off with vaccinations, we were vaccinating the people that were very at risk if they got COVID.
Yep.
So, for instance, my dad, who is 88, he asked me way back at the beginning, should he take this vaccine or not? I've taken the vaccine. I've taken 2 doses of Pfizer really early on, but I'm not taking a booster. Maybe we'll discuss that in a minute. And I took that because I was led to believe it was to protect my patients. But in fact, then it turned out you could still catch it, you could still pass it on. Didn't protect anybody by me taking it. But for my dad, I said, look, Dad, I said, you're 88, you've got a pacemaker, you've got a few other things wrong with you. Probably if you get COVID, good chance it might carry you away. So probably you've got nothing to lose by taking it. If there turns out to be long-term risks of the vaccine, quite frankly, you won't be here. Yeah. And he took it. And I think that was the right decision. But for instance, for my 2 daughters who are 17 and 20, I said to them, absolutely don't touch it. They both had COVID. They've got the best protection they will ever have.
Yes.
And as you go down the age groups, it seems that the risks of the vaccine get greater.
Yes.
But the benefits get less because you don't need it. So they've just vaccinated far too many people. They've vaccinated into all the groups that never actually needed a vaccine, where the vaccine was more risky than the disease. And that's just bonkers.
Right. Since we're talking about the younger age cohorts and the risks outweighing any benefit, what is your view then on how Chris Whitty, our Chief Medical Officer, went against the JCVI's ruling of not recommending the COVID vaccines for the 12 to 15-year-old age group? Did that shock you? What are your thoughts on that?
Sadly, it didn't shock me.
Right.
It's pure politics. It's nothing to do with medicine.
Yeah.
And I think Chris Whitty is a nice guy. I think he's doing his best under difficult circumstances. But I think where he's gone wrong is I think he's forgotten that he's the Chief Medical Officer.
Yes.
He's in charge of the health of the whole nation and all aspects of their health. And that includes mental health, cancer, children's mental health. It isn't just the Chief Medical Officer for COVID. And COVID now is very similar in its effects on even elderly people to a bad dose of flu. And he has said on a number of occasions, we need to learn to live with this like flu. I've heard him say that half a dozen occasions.
Yes, I did too.
And then they don't go on to let us live with it like flu. We don't do this for flu. So looking at those young people, we've got this problem of the risks, the biggest of which is something called myocarditis.
Yes.
Which is basically damage to your heart muscle.
Yep.
Now, why that is so important is heart muscle is very special. It's not like the muscle in your biceps. If you want to make your muscles in your arm bigger, you can go to the gym and you can lift some weights and your muscles in your arms will increase. Heart muscles, not like that. You have the number of heart muscles that you're born with. If they get damaged or destroyed, they're not replaced. They repair with scar tissue. And the problem when you have scar tissue in your heart, if say 10% of your heart muscle is replaced by scar tissue, your heart's pumping ability is reduced by 10% because that scar tissue can't contract and squeeze out the blood. But it's even worse than that, because as the rest of the heart squeezes out the blood, the heart muscle, that the scar tissue will bulge out, and it's not reduced by 10%, it's maybe reduced by 20%. Right. Now we know, if we look at other types of myocarditis from infections and things, we know that the 5-year death rate from that is 50%. So half the people that get myocarditis from infection, right, half of them are dead in 5 years. Half. I mean, that is just astonishing. The only possible treatment is a heart transplant. Wow. You know, probably the biggest operation you could ever put someone through. And we're talking about children. Now, what we don't know at the moment is this myocarditis that you can get after a COVID vaccine, is that going to be a worse type of myocarditis or a lesser type of myocarditis? The issue is no one knows, because this is all new. So I can't claim that there's going to be lots of kids dying in the future of myocarditis, because it could be maybe very minor. But the thing is, we don't know. And kids are not at risk from COVID. So if we don't know, why take the risk? Yes. There is some evidence from the States, from looking at, for instance, various chemicals that get released from damaged heart muscle, that those releases of markers are much, much higher after a COVID vaccine myocarditis than after a viral myocarditis. So the worry is this type of myocarditis even worse? No one knows at the moment. So if no one knows, don't risk it.
Yes, it's very concerning. I mean, I had the opportunity to interview Dr. Peter McCullough, who's a leading cardiologist, yes, in the US, and his report on the vaccine-induced myocarditis, just analyzing the data solely provided by VAERS, the American vaccine event reporting system. They came up with shocking data. And he was adamant that it's not rare and it's not mild, the cases, and approximately 90% end up in hospital. But primarily it's affecting male youths, young, teenagers, and I think after the second dose, they're seeing a fivefold increase in myocarditis. Now, based on and obviously it's an infamous paper in the sense that it was pulled very abruptly by the publishers, by Elsevier and Current Problems in Cardiology. So it essentially was censored, this paper, in the run-up to the FDA's review meeting on whether to authorize the Pfizer vaccine for 5 to 11-year-olds. So I'm going to talk a little bit now on censorship. Dr. Hinton, have you had any first-hand experiences with censorship, or have anybody you know? Would you care to talk about this topic?
Yeah, absolutely. I think one of the problems with the Peter McCulloch and Jessica Rose, I think, paper was the issue is a lot of these American journals have quite a lot of their income that comes from something called preprints or postprints. Yes, so basically something gets in the journal and you can have a printout of that particular paper.
Yes.
Now, most doctors don't use that at all anymore now, because we would go onto the internet and we would have a subscription to that journal online. and we'd look things up online because it's very easy to search for in things. And so there are virtually no researchers or doctors that would bother about getting those reprints. Who buys the reprints? The reprints are bought by drug companies to give out to doctors. And a significant, and those reprints aren't cheap. They're not like little photocopies. They're nice, very, very glossy equivalents of the original magazine.
Yes.
So they'll cost a few dollars each, not a few pence, and they buy hundreds of thousands.
Yes.
So many of these journals depend on the drug companies to buy reprints. So that puts them in a very difficult position. Now, there's some even worse things than that, if you like. That was a case of two well-respected researchers, one a well-respected physician. Their paper had been peer reviewed, it had been accepted, and then strangely rejected again. And I think that's going to end up in court.
Yes.
But even worse, it's more insidious than that, because there is another recent paper that was talked about by Asim Malhotra, I think on GB News, and it was looking at damage to, again, cardiac muscle and the lining of blood vessels that this group had found, and they'd published their results. And actually, he knew via a whistleblower from a large Oxford group of researchers that they'd done a big study and they'd found the same thing. Now, their paper was never rejected because they made their own decision. They were not even going to submit a paper because it would have affected their funding. So that, in a way, is even worse. At least we all know about the paper that McCulloch and Rose did.
Yes. Yes.
And it's probably had far more attention, the fact that it was accepted and then rejected. This sort of self-censorship.
Yes.
I'm not sure how those people sleep easy in their beds, really. Now, I find the same thing with interviews. It's great to be on here doing this interview today. There's a couple of mainstream broadcasters I can get on in the UK and give us a fair hearing.
Yeah.
But for instance, yesterday, I went into a studio to do an interview. And before I arrived, the format was supposed to be myself and a microbiologist discussing this new variant.
Right.
And I said, oh, well, that's great. We could do that as a debate then. I said, that'd be good. I said, and actually, I would think myself and the microbiologist, probably most of it we would probably agree on. I said things like, you know, in general, viruses as they mutate transmit a bit easier, but get a little bit more mild. I said that's a pretty standard accepted thing. I said there may be a few nuanced differences, but it'd be good to discuss those. Anyway, I arrived in the studio and I said, oh, who's the guy then that I'm debating with? Oh, he won't go on with you. Wow. No, he wants to do it separately. I said, okay. I said, you know, I don't bite, but yeah, fair enough. Okay. And of course, he had insisted that he went on second. So I was actually physically in the studio, did my bit of the interview and stuff like that.
Right.
And then I could see on the monitor the rest of it continuing with this guy. And his first remarks were, oh, well, it was very good to listen to Tony, he said. He said, but actually a lot of the things he said were incorrect. And then he starts, and the very first thing he said was, he said, it's not true, he said, if you get COVID, he said, you do not get good immunity. You get the best immunity from the vaccine.
Oh my goodness.
Well, that is totally untrue.
Yeah.
But I couldn't get the chance to get back on and discuss that, you see. So the next time I know that trick, I should say, I'm going second.
Yes. Now, can you tell me what program was this? What studio?
That was on GB News. And I have to say, the two places where we get a very good, fair hearing And we often get very, very difficult questions. And I'm absolutely up for difficult questions. It makes for a better interview.
Yes.
Our GB News and Talk Radio. But the BBC, Channel 4, not possible. And in fact, today on Twitter, in fact, it started last night on Twitter. There's a chap in charge of the BBC Misinformation Unit, it's called.
Right. I'm very aware of that.
And he called me basically a liar for things that I'd put on Twitter.
Right.
Now, I hadn't seen that because he didn't tag me in on it.
So he's trying to fact check you.
He liked to say that I was a liar, but didn't want me to know that he'd said that, which I think is a bit sort of weaselly, really. But anyway, so some other people brought it to my attention, and I just sort of watched for a bit. And by this morning, he'd agreed that that was a bit strong, and he changed it to everything I put on Twitter was wholly wrong.
Wow.
So anyway, quite a lot of us asked him what it was. Could he give one example where I'd been wholly wrong? He still hasn't given me an example. I offered to do a debate with him.
Yes.
About any issues he wanted to talk about. I said we should do it live on the BBC. And again, he didn't reply to me. He replied to somebody else to say, oh no, he is an independent journalist, and he doesn't do debates himself, maybe an interview. Anyway, that was also sent to me by the person that it went to. Right. So I got back onto him. I said, that's fine. Yeah, an interview then. I said, either an interview by you or an interview by anyone of your choice.
Right.
And then I direct messaged him and I said, look, you know, you need to sort this out. You either need to stop saying what you're saying, or you need to give me the opportunity to go on. I'm happy to be asked about anything you want to ask me about. I said, you might be surprised. You might find out that I'm right. And he said, great. He said, yeah, we'll do an interview. We'll get back to you. But I'm not expecting to hear anything else.
Yes, it's shocking. And is this man, does he have any medical expertise? Is he a doctor? This BBC?
No. He's the editor of something called the BBC Misinformation Unit. Right. Now, I was obviously under the mistaken impression that the BBC Misinformation Unit was to stop misinformation. Sure. But it's obviously the complete opposite. His job is to put out misinformation. Mm-hmm. And he still hasn't given me one example of anything I've said that is incorrect. Not a single example.
Wow, it's shocking, isn't it? It's just a sort of slander, trying to defame, you know, it's really awful. And obviously you must be aware of the Trusted News initiative that is led by the BBC.
Yes.
Up in 2019 to combat vaccine sort of misinformation / disinformation. And the name itself, I believe, is a misnomer. There's nothing to be trusted about them.
In medicine and science, you have to have open, free debate.
Yes, exactly.
Medicine and science only moves on because we disprove the current accepted dogma.
Right.
And something new takes over. Eventually, much of that will be proved to be wrong. I don't take it as a personal affront if people call me out for something that they think I've said wrong. I'm sure there are things that I've said wrong, but we need to debate it.
Yes.
And one of the reasons we have got in such a mess is that from the first few weeks, no debate has been allowed. People such as Carl Hennigan, you know, very sensible people, the people that brought out the Great Barrington Declaration, which I was one of the first people to sign up to. I mean, that was the way to go. Yes. If we'd gone that way, this would have been all over by now. One of the reasons I believe the UK is actually in a pretty good position at the moment is that they did open up everything on the 19th of July.
Yes.
They should have done it earlier.
Yes.
And actually, I was quite shocked that Boris Johnson panicked a few days ago and brought in all these things when
Yes.
actually we should have just waited. Even the World Health Organization now is saying we should reconsider all these travel restrictions. We shouldn't be panicking. It looks like it's mild. We just got to calm everything down. But I'm afraid in politicians, there's always this something must be done mentality. Yes. And so someone else says, well, here's something. And then someone else says, so let's do it. Without any questioning if, could that possibly make things worse rather than better? And we're back to the lockdowns.
Yes, something to do with the GMC. Do you want to talk about?
Yes, well, so from time to time, you get tweets from anonymous accounts.
I see.
That are usually fairly vitriolic, and I can put up with that really. And they'll usually tweet the same tweet through to the GMC, which is the General Medical Council, who governs doctors. And I think actually, I don't take it as a personal thing, because actually, I don't think it's aimed at me personally. What it's to do is it's to discourage other doctors from putting their head above the parapet.
Yes.
Now, I do still do some work, and I enjoy that work, and I want to be able to continue to help patients.
Yes.
And so it is a bit difficult for me for some of the things that I say, but what really got me involved in interviews and social media was when it was suggested that children should be vaccinated.
Right.
And for me, that was really the red line. That's what really put me into this in a big way. Yeah. And at the time, I just thought, well, actually, you know, if this does cost me my career, which I like, well, so be it. Because I want to know when all this is finished that I did everything I could possibly do, no matter how small that contribution is, to try to end some of this craziness.
Right.
And if I know that I've done that, I can sleep easily, and, you know, I'll live with the consequences.
So you're very brave. You have stuck your head above the parapet. So I commend you for that. Why do you think other doctors have not spoken out against all this or been as vocal as you? What's your view on that?
There are a number of reasons. There are some colleagues I speak to that agree with the government stance. And that is probably a good 25% of doctors. And that's absolutely fine. And I have discussions with those people and I try to change their mind and influence them. There are a very large group that I speak to that, for instance, I say to them, what are you going to do about vaccinating your children then? And these are people that I know well. I know their children have had COVID because they've told me, and they just say, oh, you know, I'll do that. Well, why wouldn't I do that? And I say, well, aren't you worried about, say, myocarditis? And they look at me blankly. They've never heard of it.
Wow. That's so
there are a lot of people that just, I mean, I probably study this more than most, I have to agree. But, you know, these things are in the papers now. It is on the news now. It's stuff that doctors should keep abreast of.
Right.
It's the biggest thing in medicine at the moment.
Yes. Yes.
And you should at least know the basics. I would say then there are another 25% that would pretty much agree with most of what I say. But particularly if they work in the NHS. So, for instance, there was somewhere where I have meetings, every hospital has a medical director. And that's like the top doctor in the hospital.
Yeah.
And we were talking at a meeting and I said, oh, well, actually, I said, I'd quite like to spend a little few minutes just talking about kids' vaccinations. And he said, oh, yeah, he said, I know, Tony, he said, I know you've got a lot of data on that. And I said, well, how do you know that then? And he said, well, I follow you on Twitter. And he was very supportive. But he's never said a word himself. because, for instance, if you're working in the NHS, there will be a clause in your contract that you're not allowed to speak out about these things.
Right.
If you did, you'd certainly be probably suspended. Right. I remember speaking to there was an orthopedic, I can say this chap's retired. There was an orthopedic surgeon I worked with many years ago, and there were problems as ever with NHS waiting lists. And this chap was a highly specialised orthopedic surgeon, one of the few people in the country that reconstructed people's pelvic bones, so the bit where your legs join your body, after road accidents.
Right.
And that is a very critical thing. If you go ahead and correct that jigsaw puzzle of bones within the first 24 hours, it's back almost perfect. If you leave it a week, that patient's going to be in a wheelchair forever.
Wow.
And what they wanted this guy to do was stop doing those and start doing some routine thing called arthroscopies, where you sort of look in the knee and wash out the joint. And he said, there's plenty of other people that can do that. They might have to wait a little bit longer, but these people can't wait. He went through all the normal hospital procedures, exhausted it, got nowhere. He went on the Today programme on Radio 4. Fantastic interview, sorted out his problem. I spoke to him a few weeks later. He said, Tony, I would never do that again. He said, there have been people tapping my phone, people outside the house, people harassing his family. I mean, these were people from government agencies. He said, sadly, he said, if the same thing happened again, he'd just keep quiet and do as he was told.
Tony, I wanted to ask you, for people who are watching this interview and are getting concerned, obviously we're in it's winter, the weather's getting colder, we know we have this new variant, and maybe they're sitting at home and they're getting more and more concerned. What advice would you give them?
There are some very simple, cheap things that people can do to help to protect themselves. I take vitamin D, I take vitamin C, I take zinc. All those things help your immune system to stay as good as possible. And there's lots of data right back from the beginning of this pandemic, mainly from Italy and Spain, that showed the people that did worst in ITU in terms of their chance of dying were those with low levels, particularly of vitamin D. And in the UK, everyone in the winter has low levels of vitamin D. I take it all year round, but you can get that in any high street store. It costs pence. The other thing to do is just exercise a bit more. You don't need to go to the gym, go for a walk. And if you can, just lose a few pounds, because being obese is also a very bad predictor of outcome if you end up in hospital. Right. So they're just simple things you can do, don't hardly cost anything, and will make a difference to people.
People who are sort of debating whether to get the booster, what would you recommend that they do it? Would you say don't? What's your sort of thoughts on that?
Well, there's certainly conflicting views. I don't think there's conflicting evidence. I think the evidence is quite clear. And if we even go to somebody like Professor Dame Sarah Gilbert, who was one of the people that produced the AstraZeneca vaccine from Oxford, and her other Oxford colleagues are pretty much all saying that if you are maybe very elderly, very infirm, you have immune problems, you're immunocompromised, then it's probably sensible to take a booster, but you don't need it until 6 months after your previous dose. But for everyone else, a booster isn't needed. I've taken 2 doses of Pfizer. I'm not taking a booster. I've checked my antibody levels. They're very good. Right. And I would say anybody that's had COVID does not need a booster, because if you've had COVID, you already have the best protection you will ever have. So no matter how small the risk from the vaccine, there's no point taking even a small risk if you don't need it. So for me, a booster's a no-no.
I wanted to speak to you briefly on the vaccine passports. What's your view on that?
Well, my view on the vaccine passports has changed quite a lot. The first thing I would say is medically, it's completely illogical, because we all know now that whether you're vaccinated or not, you can catch COVID unless you've had it before, and you can pass it on. Makes no difference whether you're vaccinated or not. So the vaccine passport is useless from a medical point of view. So then you have to say, what is it really for? And even just maybe 2 or 3 months ago, my view was the vaccine passport is a way to push people to take the vaccine.
Mm-hmm.
But actually my view now has changed. I think the vaccines are to push the vaccine passport. And the vaccine passport will become a digital ID. Things that lots and lots of politicians have wanted for many years. We can go back to Tony Blair. Of course, then it wouldn't have been on your phone. It would have been a little card.
Right.
But many politicians have wanted a digital ID.
Yes.
And a year from now, if we have digital ID, the one thing that will not be on it is anything to do with your vaccines, because that's not what it's about. It's
Right.
about control, and it's about seeing what people are doing. It's in the hands of a nefarious government.
Yeah.
It could be very, very dangerous and abused, and we should resist it.